Our GALILEO-4D is actually a randomized clinical trial focused on the subclinical leaflet thickening and reduced leaflet motion, while the main trial is looking to the clinical endpoints. So our trial is comparing a Rivaroxaban-based antithrombotic strategy with an Antiplatelet-Based Strategy for the prevention of subclinical leaflet thickening and reduced leaflet motion, and specifically transcatheter aortic bioprosthesis. So first about the design, I think the patients who were eligible for the study were patients who had undergone successful TAVR and who had no indication for chronic oral anticoagulation, so meaning thereby excluding actually the patients with atrial fibrillation. And then patients were one-to-one randomized after TAVR to Rivaroxaban-based strategy, meaning combination of aspirin plus Rivaroxaban 10 milligrams after 3 months, stopping with aspirin and continuing with Rivaroxaban 10 milligrams, versus antiplatelet-based, which is the classical combination of aspirin plus clopidogrel and continuation of aspirin after 3 months and stopping with clopidogrel. However, important to say, the 4D-CT is a mainly imaging-based study, and the endpoints, all endpoints in the 4D were at 3 months. So after this combination of antithrombotic treatments. Yeah, so we had 230 patients in, one-to-one randomized. As a primary endpoint, we looked at the proportion of patients with at least one leaflet with reduced leaflet motion grade 3 or more. What does this mean? It means that it was involving more than 50% of the leaflet. And this was observed in only 2% of patients in the Rivaroxaban arm versus 11% in the antiplatelet arm. So indicating an 80% reduction of this rather severe grade of reduced leaflet motion. As a main secondary endpoint, we also looked at any degree of leaflet thickening, and this was observed in 12% of the patients in the Rivaroxaban arm versus 32% in the antiplatelet arm, so thereby indicating a 60% reduction. So these were the two main endpoints. We also looked at some echocardiographic outcomes. There was no difference. We also looked at clinical endpoints, but of course this was not the main study aim, but there were too few to say anything significant about this. Knowing the results of the main Galileo trial, where it was kind of negative, more bleedings, and knowing the results of the 4D, where it was giving a 60 to 80% reduction of the subclinical leaflet thickening and reduced leaflet motion, I think we have kind of conflicting results there, and I don't think the data clearly show that we cannot implement this or extrapolate this to an all-comers population, that we should start implementing this in clinical practice. Absolutely not. I think on the other hand, these two trials give as the first real data from a randomized clinical trial of post-TAVR antithrombotic treatments. And these data will be very valuable when designing the future trials investigating post-TAVR antithrombotic strategies. So currently, no change in practice, but it shows that there's definitely need for future trials, and they give the perfect information to design these.